I want to talk to you today about a study that puts a real number, a hard scientific number, on how much longer you can actually live by following specific lifestyle habits. Not in theory, not from animal research, from real data tracked across real people over 3 decades. The research was published in the journal Circulation in 2018, one of the most respected cardiovascular journals in the world. The researchers followed over 120,000 people for more than 30 years and asked a deceptively simple question. If you adopt healthy lifestyle habits, how much longer do you actually live? The answer was this. Women who followed all 5 healthy lifestyle factors lived an average of 14 years longer than those who followed none. Men lived an average of 12 years longer, not months, years, over a decade of additional life, and crucially, additional healthy life. These were not extra years in a hospital bed or a care facility. These were years of functional, independent living. My name is Dr. Victor Hayes. I practice preventive medicine, and this study represents some of the most important data in the field. Let me walk you through the 5 factors and explain why each one matters biologically. The first factor is never smoking, and this one carries the largest individual effect size of all 5. Smoking damages almost every system in the body simultaneously: lungs, heart, blood vessels, brain, immune function. The biochemical damage is extensive and well documented across decades of research. The good news is that the risk reduction from never smoking, or from quitting if you currently smoke, is substantial, and it begins almost immediately after stopping. Blood carbon monoxide levels normalize within hours. Cardiovascular risk begins falling within weeks. Within 10 years of quitting, lung cancer risk drops to roughly half that of a continuing smoker. If you are a smoker and you want to do one thing for your long-term health, this is it, with no close second. The second factor is maintaining a healthy body weight. The study used BMI as its measure, with a range between 18.5 and 24.9 defined as healthy. BMI has real limitations as a measurement. It does not distinguish between muscle and fat, and it does not tell you where fat is distributed on your body. But as a population-level marker, it holds up. The broader principle is clear. Carrying significant excess weight, particularly around the midsection, places chronic strain on your cardiovascular system, your metabolic pathways, your joints, and your inflammatory machinery. What the research consistently shows is encouraging. Even modest reductions in excess weight, particularly visceral fat around the abdomen, produce meaningful improvements in metabolic and cardiovascular markers within weeks. You do not need to reach an ideal weight to begin seeing measurable benefit. The direction of change matters as much as the destination. The third factor is regular physical activity. The study defined this as at least 30 minutes of moderate to vigorous activity per day. Moderate means exactly that. Not intense, not extreme. A brisk walk qualifies. A bike ride qualifies. Swimming, dancing, or any sustained physical activity that elevates your heart rate qualifies. You do not need to be training for a marathon or spending hours in a gym. The research threshold for meaningful health benefit is considerably lower than most people assume. What is particularly important to understand is this. Going from completely inactive to moderately active produces the largest proportional gains in health outcomes. If you are currently sedentary, doing anything, genuinely anything, is your most powerful move after smoking cessation. The return on that investment is disproportionately large in the early stages of physical activity adoption. The fourth factor is moderate alcohol consumption. The study defined this as approximately 1 to 2 drinks per day or fewer. I want to be transparent about how the science has shifted here. The World Health Organization now states clearly that there is no safe level of alcohol consumption from an overall health risk perspective. We know that alcohol increases cancer risk, raises blood pressure, disrupts sleep architecture, and promotes visceral fat storage. Research since this 2018 study has moved toward a more cautious position than the study's framing suggested. What remains clear is the dose-response relationship. The further you are from heavy drinking, the better your outcomes. If you do not drink, that is the ideal position. The study data reflects a general population effect, and the other 4 factors carry far more weight. If you do drink, less is consistently better. The 5th factor is diet quality. The study used a validated healthy eating score that rewarded high intake of vegetables, fruits, whole grains, nuts, and healthy fats, and penalized high intake of red and processed meat, refined carbohydrates, and sugary drinks. This is not a specific named diet. It is a pattern. More whole foods, less processed food, more plants, fewer packaged products. It maps closely onto what the Mediterranean dietary pattern and the DASH diet both capture, both of which have strong independent evidence supporting them across multiple populations and study designs. Now here is the part of this study that I find most compelling, and that is rarely highlighted when people discuss it. The researchers did not just look at how long people lived, they also estimated what proportion of early deaths could have been prevented if everyone had followed all 5 habits. The numbers are striking. Approximately 75% of deaths from cardiovascular disease and approximately 50% of cancer deaths in the study cohort were estimated to be preventable through consistent adherence to these 5 lifestyle factors. 3/4 of cardiovascular deaths preventable through lifestyle. And the effect is not simply additive. The benefit does not rise linearly as you add one factor at a time. Following all 5 together produce dramatically better outcomes than following just 2 or 3. The factors reinforce each other. A high-quality diet supports healthy weight maintenance. Healthy weight makes physical activity easier. Regular activity improves sleep quality. Better sleep reduces the drive to overeat and supports metabolic regulation. The habits form a mutually reinforcing system, which is why the whole is significantly greater than the sum of its parts. I want to address the question that comes up every time I discuss this kind of evidence. People say, what is the point of all this if I have already spent 20 or 30 years not doing these things? The answer is that it is never too late. Your body has a remarkable capacity to respond to being treated well, even after years of not being treated well. The cardiovascular risk reduction from quitting smoking begins within days of stopping. Exercise-induced improvements in insulin sensitivity appear within weeks of starting. Dietary changes produce measurable improvements in inflammatory markers within months. You have enormous potential to shift your biological trajectory at any age. The best time to begin was 2 decades ago. The second best time is right now. 5 factors, not a supplement stack, not something you can purchase, not a protocol that requires a prescription. Just 5 behaviors, followed consistently over years. Not smoking. Maintaining a healthy weight. Moving your body regularly. Minimizing alcohol. Eating predominantly whole foods. 12 to 14 extra years of healthy life. The research is clear on what that requires. The only question is what you choose to do with that information. If this was useful to you, please share it with someone you care about and subscribe to this channel for more evidence-based content. I will see you in the next video.